Hello, everyone. Thank you so much for coming here, and thanks for coming to EA Global. So today we have a talk for you called Quantifying Animal Suffering and the Impact of Welfare Interventions by Cynthia Schuck, who is the research director of the Welfare Footprint Project. So in this talk, Cynthia is going to describe their approach to quantifying animal suffering and how it can be used to measure the impact of interventions and inform policies. She will also address major gaps in welfare research and in our understanding of suffering. The talk will conclude by highlighting how collaboration with organizations and academics is key to enabling the broad mapping of animal suffering across settings and points to promising areas of high impact work. So Cynthia earned her PhD in zoology from Oxford, which was followed by postdoctoral research on the evolution of advanced cognition. And since 2018, she has been the research director of the Welfare Footprint Project. So as a reminder, if you have questions for speakers, you can submit them on the Swapcard app. The way you would do that is if you open up the session on Swapcard and you go to the live chat section, you can just submit your questions and I will choose a selection of questions at the very end. And we'll have office hours later, right after this talk. So without further ado, welcome Cynthia to the stage.
Thank you, Angelina. Good morning, everyone. So I'll start with a few questions for you. And which do you think is associated with more suffering? Tail docking without analgesia in young piglets, or the wounds emerging from tail biting in growing pigs with the intact tails? Or a short life marked by disease and impairment as a result of fast growth rates? Or a longer life with slightly better welfare, but under conditions that are still far from ideal, so a longer net negative life? 6 eggs or a whole chicken? Or more generally, how much animal suffering can be averted with different asks, different reforms, campaigns, funding strategies, and so on? So for example, with more welfare-friendly housing systems, with the use of different stunning techniques before slaughter, by improving, in the case of farmed fish or farmed shrimp, water quality, things like dissolved oxygen, or by reducing stocking density, or by setting genetic limits to the growth rates of breeds, or even by banning bodily mutilations such as tail docking, beak trimming, surgical castration, and so on. So this is a type of question that I'll be addressing and how we approach this problem. So Vladimir and Vladi is the co-founder of the Welfare Footprint Project, and also the brain behind most of the methods we developed. We are both zoologists and evolutionary biologists, but we worked for many years on global health. And just recently, in the last years, we switched gears and started working on quantifying animal suffering. And I think that our years in global health gave us a somewhat different perspective than what is typical in the animal welfare sciences to approach this problem. As you know, in global health, you have a very large emphasis on quantitative methods. And you need to compare the burden of different diseases, different causes of mortality, different causes of morbidity, and so on. And here, in this project, we first started by reviewing the animal welfare literature to see if there was any model, any method that would be applicable to answer this type of question. And there are indeed many welfare assessment models which are very good, but they have a more restricted scope. None of the methods we found enabled answering or comparing things like different welfare problems, different production systems, or even welfare among different species. And this is a huge challenge for organizations, for institutions who need to make decisions on the allocation of money, time between different causes, or even among consumers who want to align their choices with their ethical values. So we developed this method that I will be presenting, And the method is based on this recognition that a biologically meaningful metric of suffering that is amenable to comparisons is needed to quantify and compare the magnitude of suffering associated with different welfare problems, policies, interventions, and so on, to integrate animal welfare concerns into different types of analysis, environmental analysis, social analysis, economic analysis, and more broadly, to raise awareness among the general public about how much suffering is embedded in each unit of animal source product. So in each egg, in each liter of milk, in each pound of meat, etc., with a metric that anyone can understand, with a metric that is not abstract. So this is how the Welfare Footprint Project was born. It seeks to quantify animal suffering due to different problems and living conditions using this meaningful metric, and help determine the most effective courses of action to improve animal well-being. Long-term goal, it might not be achieved in our lifetime, but we want to add our grain here, is to help create a world where pain is visible, shifting it from something that now is more abstract into a measurable and extensively mapped phenomenon. Okay, so how do we do it? The first thing we do, and it may seem trivial, but it's not, is mapping the life stages or the production stages, in the case of farmed animals, involved in the life of the species we are interested in, and the welfare problems within each of these stages. So it could be just a moment of the animal's life, or it could be just the entire production chain, like in a life cycle analysis. For example, in this case, we were interested in quantifying the suffering associated with a particular stunning technique for broiler chickens. So we mapped all the stages involved in the stunning process and the approximate duration of each of these stages. I think it's perhaps too small. But anyway, the duration of each of the stages. And in this case also, the proportion of animals that would be alive and conscious enduring each of these stages. Now, once you have this clear, then we try to identify the welfare problems that are present in each of these stages. So here, for example, during the shackling process, you can have wing fractures, you can have the compression of the lungs because of the inversion, you can have the compression of the legs because of the shackles, fear, and so on. In the last stages, for example, for those birds that were not stunned effectively, you can have the experience of life scalding, fear, etc. And we can do this for just one moment or more broadly. So say we were interested in the welfare footprint of pork meat. So in that case, we would need to map all the life fates, the types of animals involved in the production chain. So for example, all the market pigs, the animals that will become the meat, all the female breeders, the male breeders, the animals that die before slaughter, and so on. As many types of animals involved in the production as there are. And for each of these life fates, we need to map their life stages. So for example, here we have the example for the female breeders, the sows, in intensive systems. So from the suckling, post-weaning phase, growing, and then a repeated cycle of conception, gestation, and farrowing for many times. And once we have this mapping with the respective times, so the width here is the time that they spent in each of the cycle, then we can identify the welfare problems that can occur in each of these moments. So in the case of sows, you have lameness, you have gastric ulcers, you have skin ulcers, you have respiratory disease, you have the deprivation of highly motivated behaviors, and so on. Now, once we have this mapping, and as I mentioned, this may seem trivial, but it's not, because many of you need this understanding of of the process to identify the problems that the animals go through. And this is something that's very rarely done, and many insights can come out of this exercise. And this is something that can be used with the method I'll be discussing, but with any welfare assessment method as well. So once you do this, once you have all the welfare problems identified, then we can quantify the magnitude of suffering associated with each of these problems. So we do this by using a metric that we call cumulative pain. Cumulative pain stands for cumulative time experienced in negative affective states, either physical or psychological, of different intensities. So as you can note here, we use the term pain very broadly to mean any negative affective state. So it could be physical pain, it could be hunger, thirst, fear, frustration, anything that is unpleasant. And this metric is universal in the sense that time experienced in unpleasant states can be measured in chickens, in shrimp, in fish, in wild animals, and even in humans. So here's our contribution back to global health. And as you may have noticed from the definition as well, there are two dimensions of the pain experience that we focus on, which are duration and intensity. And this is one of the major differences with the other welfare assessment models. By and large, the animal welfare sciences has greatly ignored the time dimension of the problems, not only in terms of the assessment models, the methods that are used for welfare assessment, but also in terms of data collection efforts. So there's very little data on the duration of the problems that the animals experience, the onset, so when they start in the life of the animals, their frequency, and so on. And we think it makes sense to think of intensity and duration. For example, if you had to think of the worst possible suffering in the world, one good answer would be that with the highest possible intensity and the longest possible duration. So the focus is really this, duration, intensity, and when we talk about populations, we also take into account the prevalence of the problem, how many animals experience the problem. And the way we describe the pain experience is using a notation system that we call pain track. It's like this table here, it's like music notation, where you have time in the horizontal axis and intensity in the vertical axis. And here we have the description of the pain experience associated with a bone fracture by a human patient. So this is divided in 4 time segments that we call. Each segment represents a specific phase of the pain experience or a healing phase. And in this case, pain was very high, very intense immediately after the fracture. Then it remains intense during the inflammation period, and then it gradually subsides as the healing process progresses. So this is just like a simple way of taking note of the pain experience that is used in clinical settings, in notes by physicians, and so on. Now, when there is uncertainty about the pain experience, the duration and intensity, then we use a slightly modified version, which we call the chance mode, in which we attribute uncertainty ranges for the duration of each of the time segments, like this, and probabilities for the intensity of the pain. That pain is one or the other intensity. And this is the predominant mode that we use for the animals. Okay, so with the animals, we also have used these 4 categories of pain intensity. They are defined by very tight criteria. I will not go through every one of them, but generally, annoying pain, for example, is just an annoyance, a discomfort. This type of pain can be ignored most of the time. It doesn't lead to major changes in behavior, in activity levels. The animal can still enjoy positive experiences. So if you see an animal playing, it could have annoying pain. With disabling pain, then it's very different. For example, this is the type of pain, as the name says, that disables. If it was, in the case of humans, it would be the type of pain that would put you in bed. With disabling pain, you expect to see major changes in behavior, in activity levels. From a pharmacological perspective, you expect to need very high doses of very effective drugs to mitigate the pain, so painkillers or psychotropic drugs to mitigate the pain at this level. Positive experiences are very, very limited. Most of the attention is on the pain as a very intense and loud signal, and major disruptions in cognition, in attention, and so on. Excruciating pain is something that we use very, very cautiously. It's the type of pain that if it happens in humans, for example, it would be associated with torture-like pain, or the pain that make people jump from buildings, or the pain of being burned alive, and so on. So we use it very, very cautiously. Okay, so an important question. Can the affective experiences, the intensity of the pain that animals feel, non-verbal subjects, be measured? How do we do it? So, clarifying aspect is this: any form of welfare assessment, or any method of welfare assessment, or even any attempt to improve the welfare of animals, is already based on an assumed knowledge of what affects their subjective experiences, subjective affective experiences. So when we ask for more space, or for enrichment, or for access outdoors, or for reduced stocking densities, we are already assuming that this improves their subjective affective experiences. So this assumption is not unique or particular to this method. It pervades all efforts to improve animal welfare. And to make this assessment, and we make this assessment for each of the time segments of the pain track, we rely on multiple indicators, as many as there are available. For example, behavior, physiology, neurology, immunology, pharmacology, the effects of drugs on behavior, evolutionary reasoning on the adaptive value of more or less intense pain, knowledge of the signaling pathways, neurotransmitters, and so on. Homologies in the symptoms of pain, so if a closely related species has symptoms that indicate pain, it's possible that your species of interest may be feeling pain at this level as well, and so on. So we can gather all the knowledge and evidence available to make these estimates. This is just a list with some examples. It's not an exhaustive list, but vocalizations, facial expressions, hormones, etc. And just to give you an example with behavior. This is just behavior. We do the same with physiology, neurology, and so on. But let's say an animal has a wound, and we need to infer the pain associated with this wound at different moments in time. So let's say that the animal there's no change in behavior or important activities, foraging, eating, etc. So this is unlikely to be disabling pain or excruciating pain. It's compatible, it's consistent with the definition, the criteria of annoying or hurtful pain. Let's say that you see the animal playing or having positive social interactions. So this, again, wouldn't be compatible with disabling and excruciating. Do drugs show an effect? Well, yes, there is some change in behavior with the drug, so it might be hurtful pain instead of annoying pain. Can pain be concealed? And so on. We have many questions that we ask for each of the problems we analyze to see what is compatible with each of the intensities of pain. And I'll give you a very concrete example. We analyzed how much suffering is associated with keel bone fractures in egg-laying hens. So most hens, if not all hens, will endure at least one fracture of the keel bone, typically more, irrespective of the housing system they are. So In this case, we wanted to know how much suffering is associated with a fracture that heals properly for the individual that suffers it. So we first developed this pain track with 5 time segments, which are the typical phases of healing: the point of fracture, a number of inflammatory phases, and the formation of the bone callus. And then we estimated the duration of each of the segments. And to do this, we use evidence of pain duration from studies of fracture healing in different species, including birds, and the inflammatory processes, the physiological processes that are triggered in avian models of fracture pain. So these were the estimates of duration. Now for the estimates of intensity, let's see, as an example here, pain at the point of fracture. One of the things, it's small, sorry. One of the things we saw, one line of evidence, is that in avian models of fracture pain, there are substantial changes in behavior and alertness on the first hours after the fracture. So this is compatible when we go to the criteria defining each category of intensity. This is compatible with disabling pain. So we have this mark there. In humans, strong analgesia is required to alleviate the pain at the stage. So again, this is compatible with the criteria defining disabling pain, and so on. For example, here, in evolutionary line, intense pain is adaptive. You need to feel intense pain to limit movement and prevent further damage. So if pain is mild or moderate, the animal may cause further damage to a broken limb or a broken keel bone. So it makes sense from an evolutionary perspective that the pain signal is loud at this point. So this is, again, more compatible with disabling pain. We cannot rule out, in some cases, hurtful pain as well. So in this case, after reviewing, and the justification for this is in the book that we have available on the site, there are more lines of evidence, but after reviewing this evidence and then discussing with the specialists, reaching a consensus, we estimate that there is a likelihood of this magnitude that pain is disabling, but we cannot rule out completely the possibility of hurtful pain. This can also represent variation in the population or variation over time. Okay, so this is like the heart of the problem. The method is not complex, it's just estimating intensity and duration of each welfare problem that the animal has. The more difficult, not difficult, but the more laborious part of the method and time-consuming part of the method is really reviewing very careful the literature, talking with specialists, putting together all sources of evidence to justify this hypothesis here. And they are really just hypotheses that we make explicit so they can be criticized, they can be improved and updated, and so on. And what the method does is it offers this platform here, so where different lines of evidence can be organized and discussed using this common metric, intensity and duration. Now, once we have this, and then we did it for all time segments, then calculating cumulative time in pain is relatively straightforward. We just multiply the likelihood there by duration, and then here we have the estimated time in pain at this moment, of disabling pain at this moment. We do this for the other intensities and have this estimate here, and we do this for all the time segments, add them up, and have cumulative time in pain, in this case hours, expected as a result of a single fracture experienced by one individual. We can do this for fractures, or we can do this for anything, really: fear, cold, hunger, boredom, etc. So in the end, we can calculate cumulative time in pain from a single welfare harm for a period of life, which could be a life stage, a single moment in time, or a lifetime. In this case, we have multiple harms, cumulative pain from multiple harms that is added they are added together, or this is usually what we use, cumulative time in pain experienced by a population. So in this case, we can compare one system with the other system, one product with the other product. And when we talk about population, we can calculate it for the average population member or for individuals that are affected by extreme forms of suffering, if we want. And the way we do it to calculate for the average population member is by taking the prevalence of each problem into account. So not every animal in a population experiences every problem, so you need to factor in the proportion of animals. For each welfare harm, you have cumulative pain, you need to factor in the proportion of animals in the population of interest that undergo that problem. So, for example, in the case of farmed fish, you have hypoxia, which is widespread. Most fish will experience some degree of hypoxia over their lives. And you have white spot disease, which just a few individuals will experience it. So let's say we calculated that for an individual that is affected by white spot disease, that individual suffers, let's say, 10 hours of disabling pain. And let's say that the prevalence of this disease is 10% in a typical population. So the average population member would experience 1 hour of disabling pain, which is 10 hours times 10%. Of course, we take into account the uncertainty regarding the prevalence, the variability regarding the prevalence, and we propagate this uncertainty in the model as well. And that's why you need to define very carefully your population. The broader the population you're considering, let's say from more countries and so on, the higher the uncertainty intervals, and the more specific the population, the narrower the uncertainty intervals. The same thing with regard to the expected variability. Okay, so why do we like this metric and why do we use it? Because it focuses directly on the ultimate target of welfare assessments, which are the affective experiences of the animals, intensity and duration of the experiences. It uses a universal metric that has biological meaning, which is time. It enables comparing suffering across different harms, problems, systems, etc. All estimates are explicit. Estimates are just hypotheses, and they are amenable to criticism. So biased estimates are very easy to spot, and improvements can be constant, should be constant, and decentralized, so similar to crowdsourcing. Now, going through some of the applications of this method, we wanted to estimate the welfare impact of cage-free campaigns. So specifically answer this question: would it be possible that due to a potentially greater frequency of challenges such as aggression, injurious packing, infectious diseases, hens may experience worse welfare in cage-free scenarios? And even if their welfare is better in cage-free settings, how much better is it? So we analyzed a number of welfare problems during the laying period that the laying hens undergo: fractures, the consequences of injurious packings, the several types of wounds, cannibalistic attacks, infectious problems, a number of behavioral deprivations, the problems associated with depopulation and transport, and so on. And what we found is that transition to cage-free housing, taking all of this into account, is expected to reduce at least about 60% of the time experienced in annoying, hurtful, and disabling pain. So here you have annoying, hurtful, disabling, excruciating for each of the settings: cage-free, furnished cages, and conventional cages. But note that the scale here is different, okay? For excruciating pain, not so much. But some things come to light here. Well, it's lower in the case of cage-free, but not so much lower. And this is mostly the result of problems that lead to sepsis. And this was an interesting thing that came out of this work. Sepsis is a very painful condition, and it's mostly neglected in the animal welfare sciences. So some things comes to light when you analyze the whole process in this very atomized and systematic way. For example, in cage-free settings, here, this intense pain, disabling pain, is mostly due to keel bone fractures. So in the cage-free settings, keel bone fractures are the most important welfare concern, and so on. Many things can be taken from this exercise. We also did it to analyze, used the method to analyze the welfare impact of the adoption of slower-growing broiler breeds. And the question here was how much suffering can be averted by setting, as I asked in the beginning, by setting genetic limits to the growth rate of broiler chickens. And would a longer life, under conditions that are still far from ideal for the slower-growing breeds, lead to more suffering because they are living longer and they are spending a longer time, possibly a longer time in pain? And we also analyzed a number of welfare problems: lameness, ascites, cardiovascular conditions, heat stress, a number of behavioral deprivations in both situations, peritonitis, hunger in the broiler breeders, and so on. And here again, you have excruciating, disabling, hurtful, and annoying pain for the reformed scenario with the slower-growing breeds and the conventional fast-growing scenario. And notice also that the scale is different. But what we found is that adoption of slower-growing breeds is expected to reduce time in hurtful, disabling, excruciating pain by at least, the estimates are very conservative, but by at least 24, 66, and 78%. Again, some interesting things pop out. So in orange here you have cumulative pain due to lameness experienced by the average population member. So lameness is the major welfare concern in broilers. And some other things also come to light. So for example, we found that chronic hunger in the fast-growing female breeders is possibly the greatest suffering, source of physical suffering for any farm chicken, including egg-laying hens. So you know that these birds grow very quickly, but they are slaughtered at a young age, 40 days more or less, 40, 42 days, sometimes even less. So they don't get to experience the problems associated with fast growth if they lived a longer life. They do experience many problems, but if they have to live for longer, then there are many more problems that they would experience. Now with the breeders, it's a problem because they have the same genetics for the very fast growth, but they have to live longer to reach sexual maturity and breed the broilers that will become the meat. So what happens, for them to be able to survive this longer life, they need to be feed restricted. They need to eat, like when they're being reared, it's only about 25–30% of the normal the normal amount of feed that a broiler would get. So they experience chronic hunger for life. And we have estimated that about 2,000 hours of disabling pain and over 4,000 hours in hurtful pain for the average female breeder as the result of hunger alone. This is even without counting the indirect effects of hunger, like increased aggression, poor resting, thirst, stress in the offspring through epigenetic effects, and so on. So this is a huge problem. Okay, when we do this, when we are studying these affective experiences, some major evidence gaps also come to light. And there are many. We have them all listed in the website. But some of the main ones are this. As I said, duration of the welfare problems that the animals endure is really something that is neglected. So any research investigating how long things last or when they start in the life of animals would be very informative and very valuable. The dynamics of the problems is also something that is not really investigated. So for example, if we had an animal that is in a confined condition, would the confinement, the unpleasantness associated with the confinement, increase over time? There would be sensitization. It gets worse and worse and worse. The animal feels more helpless, with more lack of control over time, so it's really bad by the end of his life. or it gets better. The animal habituates to the situation, and it just doesn't care as much as it cared in the beginning. Is there habituation or sensitization? It might change from problem to problem, from species to species, but we don't know much. The question of concentration of suffering among individuals. So, are there individuals that carry the highest burden of suffering in a population that are affected by multiple problems at the same time? It's likely, because they might be the ones that have the risk factors for this. But again, there isn't much research in this area, and it would be very informative to do it, because if we understand if this is indeed the case, when this is the case, and why this is the case, we would be able to design very effective interventions. And also, the role of positive experiences on pain. Distraction. I need to change this for duration, dynamics, distribution, and distraction. Then it will be 4Ds. So if an individual can engage in behaviors and activities that they are highly motivated to engage, there is the possibility that the perception of pain is reduced. Pain is not so intense. For example, distraction is used as a resource in low-income settings with human populations when they don't have money for drugs and painkillers. Distraction is effective, perhaps not with very intense pain, but with moderate pain. Distraction is effective in mitigating the perceived intensity of pain, and there's some indication that this also happens, at least with chickens, that when they engage in things like foraging, exploring the environment, the pain that they're feeling is not so intense, and even healing times seem to be shorter. So if this is indeed the case, and if this is widespread, this also has a number of important implications. Then the value of providing animals with these opportunities to express behavior and engage in other activities, the value of effective enrichment would be much higher than what we are assuming right now. So this is another area that deserves research. For a confined animal, there is the possibility that pain is their whole world. If they're in a barren environment, there's nothing to do, so their pain might be even more intense than what we are assuming. Okay, and to conclude, we have been teaching the method to a number of research groups and EA organizations, and even to the industry. Since we are a small team, and even if we had a lifetime, we wouldn't be able to calculate suffering and for the whole range of species in the different situations, farm species, wild species, pets, animals in research, etc. So it's just like this is mapping this all. It's a gigantic job. So we very much want to spread the word about the method, and we think that the method is best used by people who understand about their species and the context of research that they are working on, or the groups they are working on. And we hope that the method can make pain more visible. As I said, this is a platform where different lines of evidence, areas of knowledge, can be organized and discussed using a common metric, a common currency. If any better method comes along, we think that it should be by all means adopted. But in the meantime, we think that a good way to express to represent animal suffering is by using something that's very simple, yet it's very universal and real, which is time in pain. So, thank you very much.
Thank you so much, Cynthia. I really appreciate it. And as a reminder, if you have questions, you can leave them in the Swap Card app. So go to Sessions and add questions in the chat, and I will read out some of those. Thank you so much for your work, Cynthia. Yeah, as you know, I'm just such a big fan. I think that research like this that tries to tackle such, big, complicated questions and comes up with something so, intuitive and so easily understandable, I think, even from a layperson perspective. It's just so impressive. And
Thank you.
yeah, I guess maybe to start off with a question on, so the output of this metric, is cumulative pain in these 4 intensity categories that you suggest. And I'm wondering from a practical perspective, as you say, there might be interventions that you could imagine an intervention that affects a small number of individuals, but tries to get rid of a lot of excruciating pain, for instance, versus something that maybe it affects a lot of individuals, but it's only targeting like a small category of pain. So I guess when it comes to comparing the different categories, what advice would you have practically for people there?
Yeah, so one of the reasons that we keep the intensities of pain separate and do not aggregate them all into a single metric is to allow for this differentiation. So if people are interested in alleviating the worst forms of pain, like excruciating and disabling pain, they can focus just on those values instead of aggregating them all. There's also not much evidence on the equivalence between the different levels of pain. So how many hours of hurtful pain would be equivalent to 1 minute of excruciating pain? There's not evidence for humans. I mean, it's the empirical evidence is not there. We're about to publish a review of the literature on that. But even with humans, it's very, very hard to get at an answer, and let alone animals. So, and if we did aggregate, it would be difficult to understand what the metric means in terms of biological grounding, biological evidence. So we prefer to keep it separate because it can always be justified by biological evidence. And if organizations and institutions and policymakers want to make an assumption of how many hours of annoying pain correspond to 1 hour of disabling pain and so on, they can. So they can take the data and integrate to make their own cost-effective analysis and so on, but we prefer to keep it separate. Also because of this thing that you mentioned, in a population, you may have multiple individuals enduring like hurtful pain, and in another population, you may have just a few individuals enduring excruciating pain. But when you aggregate at the level of population, you are you are confounding things a bit, because what is like, how do you make the equivalence between a lot of people suffering, a little bit of pain against few individuals concentrate, like all the suffering concentrating in them. So we prefer to keep it biologically, like the estimates biologically grounded, and then different institutions who are working on different problems have a better ability to decide what should be the equivalences and so on to make this integration. They have the data there and they can do it.
Yeah, that makes a lot of sense. Thanks. Yeah, Michael had a question here about, so I guess, the project is called Moral Welfare Footprint, but it seems to focus only on negative affective states. Yeah, and so I guess the question is, do you consider collecting data on positive experiences? It seems like this model, you couldn't conclude that an animal had a happy life, only a neutral life or something. So yeah, could you explain that?
Yeah, so we started by focusing on suffering because we think that suffering takes precedence. And with intense suffering, there isn't even room for the enjoyment of positive welfare. So you need to mitigate suffering before, in those cases, you can enjoy positive experiences. From an evolutionary perspective, it also makes sense that suffering takes precedence because it's usually about ensuring survival and reproduction. So the signal must be loud. So you stop everything else to attend to pain and make sure you survive and reproduce. And with positive experiences, you always, you more easily reach like the hedonic level where there's like a hedonic treadmill that you reach a point with your positive experiences that you need more and more and more. It's not the same with suffering. Now, that said, we're also developing now a pleasure track instead of a pain track, and we'll start working on cumulative pleasure in addition to cumulative pain. So by using exactly the same process, with levels going, for example, from joy to bliss, and then trying to estimate the positive experiences that the animals endure over their lives. If integration of positive and negative is more of a value judgment right now, we don't know much about how much positive would be able to compensate for negative. So we'll keep it separate, and people can make their own decisions on how best to integrate these two measures.
Got it. That makes a lot of sense. That seems like really exciting for the research too. Yeah, I had a question here from Kenneth on, so I guess, I expect a lot of people maybe have pushed back on the intensity side, as you say, but, when it comes to the duration side, on measuring pain over time, Kenneth has a question about, have you considered sort of factoring in the subjective experience of time here? So, where maybe some individuals might experience like excruciating pain as happening for, a really long subjective amount of time versus something annoying as kind of more an everyday sort of time experience.
Yeah, so there might be variation in the way that different species or individuals of different ages experience the passage of time. And right now we are focusing on the basic, just time as we measure it. So as it's measured like in experimental studies, that we see the time for healing, the time that you see symptoms of distress, the time that you see departures from physiological baseline levels of the different hormones and everything, and it's our time. Now, individuals may experience time differently, and this is something that there isn't much research and scientific knowledge yet, but it's something that could definitely be applied to our estimates. If anyone has a means of saying, look, 10 seconds for an ant is completely different than 10 seconds for a cow or a human, then you can apply this correction to our estimates. So the estimates are there, and people can correct in any way. We don't feel confident enough with the knowledge that there is available to make these refinements just yet.
That makes so much sense. Yeah. Yeah, I guess you talked about this. So a lot of the work that you demonstrated was on kind of intraspecies comparisons. So, interventions focusing on the same maybe population or at least the same species. When it comes to, I know there's been a lot of literature recently in the effective animal movement on kind of interspecies comparisons, like the Moral Weights Project, for instance, which we were talking about earlier. So when it comes to doing those interspecies comparisons, I guess maybe there's problems when it comes to the subjective experience of time. I imagine you also want to account for, the probability of sentience and other factors. What advice would you give to researchers who are trying to use this metric?
Yeah, so this is the hard question.
Yeah.
And we are measuring time in pain, and we can talk about time in pain for a shrimp, for a bee, for a cow, for a human person. But another question is 1 hour of disabling pain the same for an ant or for a pig? We don't know yet. Or can an insect or a shrimp reach levels of pain intensity that are excruciating or that are disabling? The range of experiences, is it the same? So the Moral Weights Project is doing a great job at tackling these issues. For now, we are just estimating time in pain, as I mentioned, in the way that we can measure it empirically. We like to think of the different possibilities in a framework we're about to publish, in which it's a framework for organizing hypotheses about the different possibilities. So imagine a chart where in the vertical axis you have hedonic capacity, and the horizontal axis you have cognitive capacity. And there could be like a linear increase in hedonic capacity as you increase cognitive capacity. That's one of the possibilities. That there could be a very sharp increase in hedonic capacity very early in evolutionary history. And then it's more or less constant as the animals developed their cognitive capacities. So this is what we call the primeval framework. Like it arrived very early. The ability to feel more intensely different types of emotions emerged very early in the history of life. Then you have a different one that many academics like to use, which is, well, you have more or less a constant hedonic level till you reach, for example, mammals, when you believe that hedonic capacity increases a lot, the ability to feel increases a lot. That's the opposite of the primeval one. And it's a possibility. Unfortunately, we think that the ability to feel as intensively as we do emerged very early in evolutionary history because it makes sense, it's adaptive. Animals need to feel pleasure and pain to be able to respond in different ways. We think of emotions like as a heuristic for decision making. It would be very complicated to have to do all the calculations to make a decision. So this gut feeling of something being good or bad is something that enables to behave properly. And it's a pity. It would be better if it was the other way around. And we think that what differs is the type of affective experience that animals have. So perhaps not all species experience grief. But it doesn't mean that they can experience something as intense as grief, but just a different type of emotion. So we have the estimates, and then we need to adjust that. And I think this is very close to what the Moral Weights Project arrived. If anything, they arrived at a result that is closer to unity than was foreseen before. We are in total agreement in that respect.
That's so interesting. I'm so excited to read the work. It seems really important and really tragic, I guess, that if as you said, that hypothesis is true. I guess we'll do one more question and then we're going to go again to office hours right next door in 308. So Michael asks, you mentioned some interest in collaboration with other organizations. I'm curious what kind of collaborations you think would be most useful for your work, and I guess as a pitch to the audience too, if there are folks you'd like to work closely with.
So we've been teaching a number of workshops to spread the word about the method so that the organizations can use it for their own decision-making internal for, deciding in terms of asks and interventions. We've given, for example, a workshop to the team at the Shrimp Welfare Project, Fish Welfare Initiative, some people working with chickens, with pigs. We're collaborating with academics as well, working with pigs and other species. And we are collaborating in a sense that we are not only teaching the method, but we can also review the work. Of course, we cannot do the work ourselves because it's just gigantic, like the task is gigantic, and we're a small team. But we are willing to collaborate as much as we can, because the idea really is to have the mapping of suffering across different species, different contexts, production systems, and so on. And so if we can contribute in any way to groups and organizations and researchers who are interested in their own species, their own context, then we're very, very happy to do that.
Nice. Thank you so much.
Thank you.
Thank you, Cynthia, again. So we're going to go to office hours, but I really appreciate you coming here.
Thank you.